Right, so snivelling dartboard pin-up and recipient of private health donations Wes Streeting has, fresh from lauding the use of private health capacity should Labour win power. Those donations aren't for nothing, are they, Wes? Has also now declared war on the health unions. The party formed by the unions or the ordinary working class is now turning on the unions. How bold! Well, with Unite donations having nearly hit £2 million for the last year under Sharon, donations are under review Graham, and with Unison, the largest trade union in the UK, still largely right-wing led, still loyal to Labour, not to mention all those Tory donors coming on board and still sailing high in the polls, it's little wonder Labour are feeling emboldened. However, it's not those unions in particular Streeting was taking aim at. In the Tory graph at that, more the BMA, the British Medical Association, the trade union for doctors, those people who, where health is concerned, you expect to know best, certainly better than a shadow health secretary with no health qualifications whatsoever and whose only discernible talent seems to be in brown-nosing to the right people to forward his own ambitions. Streeting has vowed war on hostile health unions and accused doctors, via their union in particular, the BMA, he singled them out as being opposed to better standards of care in the NHS. They haven't said this. No health union would ever say this, and no real Labour representative would ever use language like declaring war on the unions when the unions have simply pointed out that Labour's proposals to utilise the private sector to make up staffing and infrastructure shortages whilst training more staff is not going to work and isn't the answer on its own. There isn't enough provision in the private sector for a start. For another, it'll take between 5 and 10 years to train staff from scratch to the point they're filling the more than 100,000 shortages in NHS posts we have now. Nurses, paramedics, midwives, it's 5 years or an entire parliament if they were in place ready to be trained from day one of a Labour government. Doctors can take between 5 and 8 years depending on specialism, and GPs up to 10 years because of the breadth of medical knowledge required for that role. That's 2 full parliamentary terms. It's obvious why these plans have come in for criticism, but Streeting's blatantly aggressive response belies some serious arrogance too. Those poll leads are giving Labour a false sense of security because even though they're still double-digit leads, they've halved since Sunak became PM. Even against this most awful, callous and incompetent Tory government, Starmer's Labour can't sustain that lead because it's built on sand. Yet still they're emboldened to say, we're prepared to keep the privatisation in the NHS. Starmer breaking pledges over this, of course, again. We're prepared to add even more private provision under the guise of saving the NHS, when actually we're still softening it up for sale as Nye Bevan spins in his grave over it. I mean, Blair did all of this as well, but at least he had the sense to lie about it. And if you think this is different, here's the executive political director of the Tony Blair Institute heaping praise on Screeching. By spelling it out now, Labour believe they can get away with it, still winning the next election as people vote Labour to get the Tories out, only to then be able to turn around and say, privatise the NHS? Well, you did vote for it. So you've given us that mandate to do just that. The party that created the NHS would be the same party to finish it off, though of course it'd be the same party in name only. The Tories have very much taken it over. The staff we still have in the NHS are dedicated, wonderful people, but they are overworked, underpaid, and the service is becoming more unsafe. The biggest point that the mainstream media keep omitting as strike action heads our way, as more and more leave, unable to take it anymore, and the service becomes more underfunded, but most of all, unsafe for us, the patients, the people who rely on the NHS. With those record funds we keep getting told about going into the NHS, all that investment is going into the privatised parts that sport the NHS logo. It's not really the NHS at all. Fewer are joining the service because the support for training is gone, the bursary's gone, they need more pay and support, and Labour can't even pledge to do that. Still spinning the same Tory line that we have no money when we literally print our own money in this country and putting it into the pockets of people who spend it, like NHS staff right now using bloody food banks because they're forced to, grow the economy then by spending and give the government better returns, because that's how economics works in this country. When they say there is no money, it is a political choice every single time they do it. Fine and dandy, you scrap non-dom status. I agree entirely with that. But let's not pretend doing away with a tax dodge will pay for this. The Tories won't put the money in where it is needed because they need to keep their rich donors rich, keep giving them business returns for their financial support, and Labour is no different to that now, wanting more donors and rid of its trade union foundations when trade unionism is the cleanest money in politics, coming from ordinary working class people, the likes of you and I. We need staff now in the NHS. So we need the staff back that have left. Starmer needs to stop posturing to the hard right over migration, saying we have too many migrants in the NHS, saying there's a case for putting some on tag when they get here. Can you imagine being treated by a doctor who's wearing an ankle tag? Can you picture the Daily Fail talking about our criminal GPs? When the NHS has always been that way, we've always relied on migrant workers in our NHS. Thank God for them. So many of us owe our lives, or those of a loved one, to them. Training more staff here is great, but the NHS has always relied on migrants to staff it because we have never trained enough in this country. And saying you will now, for one, won't fix the immediate crisis, and for two, is hard to believe when we've heard it all before. Streeting is a disgrace to the Labour name, a disgusting, arrogant lickspittle, forwarding his own ambitions at our expense, hiding behind his own treatment for cancer as if that makes him some staunch defender of our health service when he absolutely isn't. Naturally, Starmer supports him, a man who says the government can't afford to give nurses a pay rise, but is committed to defending funding unshakably. The defence funding, that is. It is always a political choice, especially in a country that has full control over its own currency and literally prints money whenever it wants to pay for stuff, each time it needs to. He'll always find money for missiles, it seems, but not for our NHS and its workers. Private provision in the NHS needs to be removed, not encouraged. We need to encourage those that have left back, and that requires decent terms and conditions, and yes, do the training you're promising to do to secure the service for the future. By all means, scrap non-dom status and charitable status of private schools because these are unequal and unfair. But don't pretend doing one equates to fixing the other. They're separate issues. Deal with them both properly and in our interest, because right now you're infuriating health professionals, offending trade unions, and disgusting people who can see you for what you are and what you are doing. That poll lead you think will save you can evaporate for you as fast as it did for the Tories if all you aspire to do is basically copy them. If you are out on your doorstep clapping for these people through the pandemic and you're thinking of voting either Tory or Labour come the next election, then you are a bloody hypocrite, I'm afraid. People are getting more sickened and more frustrated at our politicians because functionally they are all the same again, not operating in our interests, but the interests of those that lobby them and give them money. If you don't start reversing that, challenging them, taking your vote elsewhere, if the political system keeps failing ordinary people and ordinary lives, history has told us so many times where this eventually ends up.